Chale. As we know that slow expansion to 4 pound, I'm not going with this one. So the first question I'm going I'm going after the YouTube video I posted yesterday. So the first question I'm going is no, it's you requested an OPG for a patient. Then do you see the the video I posted yesterday? YouTube video. Yes. So you requested an OPG of for a patient. Then he brought it to you. You found that he has recently taken OPG. What would you do to manage the like what we solved previously that there was a OPG and we also like what took an OPG. Do inform the patient that there is no big harm. Inform the patient but tell him that there is no big problem. Inform the patient, apologize, document the incident, find out the cause. Inform the patient, apologize, and tell him that this will not happen. So it between no one, two. The two options we have: inform the patient, apologize, document the incident, and find out the cause. Inform the patient, apologize, and I think like what's the C option, yes. Brian is a 12 years old boy suffering from controlled epilepsy, was treated with a modified twin block. Brian initially presented with a full unit class 2 motor relationship and a retokinetic mandible with average vertical proportion. After 9 months of active phase of treatment, a bilateral posterior crossbite, how will you practically settle this? Upper immovable retainer with flat interior bite plane, no. It's not flat and deep. It's steep and deep. Use of class 2 elastics with aligners, no. Low pull head gear post treatment, no. Gradual trimming of the upper block of the twin block, MOA, it's D. You fit, you are finished, you are in finishing stage and you want to do artistic band to crack the wire. Which are the wire? So we select TMA wire, but TMA wire is too much here. Anyway, the wire is TMA, but the dimension is too much. 21, 25 is too much for artistic bands. To completed placement of upper and lower fixed appliances using self-etch primer, you place, oh God, how many times this question will come? The patient returns 30 minutes after the appointment. So hyperismatic enamel low, light no, failure to pulse, dramatic bite, failure to adequately mix, like what E. When we have solved this question, this time the picture is very good. Someone stole the original picture. So the 16 years old female presented with a class 2 T1 malapnea with an OJET of S5 millimeter. She and her parents are keen to avoid orthognathic surgery. How are the temporary inclusive device pictured most likely to aid the patient of this patient? So they have given indirect fraction for this power chain. There is a power chain given, a sleeve on one side, something, by providing direct against which the retraction of the labial segment teeth, by providing indirect anchorage to include the upper molars. See, it's a fixed segment, so it's not the intrusion, right? By providing direct anchorage to include the upper first molar node, providing indirect anchorage against which the retract, yes, D. D. A 12 years old boy attends to short treatment. He has a class 2 D1 maloplean with crowding in the upper and the lower arches. He has had 4 premolar teeth extracted and due to have fixed appliance fitted today. He explained that he traumatized his upper front teeth 3 weeks ago and this resulted in extrusion of the upper right permanent sentinel size of about 2 millimeter. What is the most? We have to give a rest period. So how much rest period for extrusion?
12 months. 12 months.
Even it's by 2 millimeter. So delay it 1 month, 3 months, 6 months, cancel it in with proceed authority at any time. So it's maximum they have given is 6 months. So should we go for the 6 months? They've given 12 months. No, it's extrusion of 2 millimeter, not avulsion. No, that is with handbook is with orthodontic treatment, right? No, this is not orthodontic. This patient is going for orthodontic treatment. So we have to see this question according to the trauma IADT guidelines, rather because this is yes. Because if for the intrusions, these things like for the crown fracture, they were saying 3 months, right? So we have to see this question according to the IADT rather than the rest periods.
Because it's different in the trauma guideline and it's different in the article.
Just give me a second. IA, oh, it's not right. IADT trauma guidelines. These are the old ones. International Association Dental Trauma Guidelines update. It's और इसको करा के भी देखिएगा. There's nothing in extrusion because there's an avulsion. The follow-up sustained duration general guideline for specific outcomes. Crown fracture, root fracture, crown fracture, enamel dentine infection. Okay. Extrusion in adult patients. So extrusion is clinical review at 2 weeks, 4 weeks, 6 to 8 weeks. Subtint removal at 2 weeks. And radiographic advice 1 year. The rest period is not given, like what the how much to do the orthodontic treatment here. Anyone like what if anyone knows the answer? How much is the rest period? Which guidelines you have? Can you show me? So 3 months rest period. Okay. So it's ABC. Even for the root fracture, they given 3 months.
So these are the new one I described. 3 months, yes, sir.
14 years old attend for just give me a second. 14 years attend for adjustment of fixed appliances. She has a decalcification present and on question she is drinking large quantities of sugar fizzy drinks. You decided to remove her fixer immediately. Her unilateral posterior crossbite has been corrected with upper arch expansion. Her arch alignment is now reasonable. However, her overbite is not fully reduced and her occlusal intercuspation is non-ideal. What is the appropriate retainer for her? No retention, no. Upper anterior bonded retainer, no, because she's taking sugary drink and decalcification. Upper vacuum form retainer, upper Holly retainer is, I think, better. Yes. Yes. 14-year-old boy attend for adjustment of his fixed appliances. He experienced an enamel dentine fracture to the upper central incisor around 2 years prior to treatment. Start of treatment. You take a radiograph 6 months into treatment, check the periapical status, and signature roots of the occur. Which of the following strategies will most effective? Ideally, the first you give a pause, right? Then you pause inactive treatment for at least 3 months. Then you start the treatment, and again, if there is resorption, then you have to like what you have to change your plan. 11 years old. This right. Okay. 11 years old patient attend emergency. He's being treated with an upper removable appliance with an interior bite platform to help reduce palatal trauma from the lower incisor. The appliance has fractured for the third time in the area of the bite form. Cold cure acrylic was used in the manufacture of the appliance and subsequent repair. What is the most? Make it in heat cure. To repair the appliance, no. To repair the appliance, no. To replace the appliance using same design and material. To replace the appliance using extending the bite plane to gain to replace the appliance using same design and heat cure. E. A 15-year-old girl is in the middle of fixed appliance treatment. Her mother asked to speak to you privately. She said her daughter may be self-harming. What advice would be most appropriate? We decided that they should talk. She should talk with her daughter. They have duty to inform local child protection in order to discuss her suspicion with daughter. So support is available from various agencies. The continuation of and patient has not been diagnosed, and that she should approach her daughter. C. C. C.
It would be inadvisable to discuss her daughter.
No, C. She should talk with her daughter if she's self-harm. And that she should approach her doctor to assess. No. Yes. That you have the duty to inform to the local child protection service that the child is at risk. This is due to inadvisable to discuss her suspicion with her daughter, and she should wait. No, we didn't. Like we said, she should approach her daughter.
That it would be inadvisable to daughter and she should until the daughter approaches.
No. Because she's self-harming herself, so there should be something done. Yes, and then she should approach her doctor to assess this sport. The continuation of the this because parents has not they've changed the options now. Because previously we decided that she should approach her daughter and like what talk with her. And if this is not there, then she should go for a psychologist or something like that. Now they do not have this option. It's not inadvisable because the patient is self-harming herself and might be she self-harm something more serious. So there is a need to do something. And the patient is like what 15 years.
If advisable to discuss her suspicion, dentist is talking to the mother that it is inadvisable
Yes.
that I should talk to her. So
No,
she should talk to you.
They said that it would be inadvisable to discuss her suspicion with her daughter, and she would wait until her daughter approaches her. No, it's for the mother. The support available from agencies, and she would either it's the dentist or the mother. This is not the right option because you have to do something. Yes, yes, that's my point. So we have to do the support is available from. Previously, there was option that the mother should talk with the daughter, right? I think then I will go with C. Then it's the option E or C.
So we said we will not go for the child protection service.
Yes, initially we won't go and they will solve it at home. So right now we have nothing here. So either we go with the support from the various agencies, right? Child protection agency or something. And she should take that support because they have changed the option now. The same question we changed option. Anyway, I'm going for the C. Because they have changed the options here now. A cleft palate deformity develops during 4 to 8 weeks 6 weeks of intrauterine cleft palate. Let me check. Cleft palate. It's 6 to 10th week of intrauterine life. 6 to 10. Option D. You're reviewing that retinal of a 12-year-old girl who has been referred for correction of a class 2D1 myelopathy, and you have decided against the use of functional appliances despite her millimeter overjet. Which factor during symptomatic analysis is most likely to have influenced this decision? 6 weeks. 6 week in basal notes.
Yes, sir. It's primary and secondary both in 6 weeks.
And what is
Yes. So still we are with the same option.
D?
No, sir, sir, you already selected D, option D.
Yes.
It is lies between these.
Because they have 6 to 10 weeks
Yes,
mentioned in
sir.
different books. Because you said that basal notes is mentioned 6 weeks.
Yes, sir.
So what's in?
So the option is 6 months.
Okay, sorry. You are reviewing the lateral ceph of a 12-year-old female who has been referred for the correction of class 2D1 myelopathy, and you have decided against the use of functional appliance despite her increased overjet. Which factor during symptomatic analysis is most likely to have influenced this decision? The E and B? E and B? Class 2D1, it can be a class 1, most likely. Reduce anterior facial height, no. Reduce anterior anteguinal notches, no. Backward inclined condylar head, increase interincisor angle, increase intermolar angle. Well, they are still thinking that you cannot do a growth modification in high angle cases. According to Tulish, Profit, and Phillips, growth can be done in a wide range of uh, like what skeletal pattern. They are giving the Bjork structural science and reduce antegonal notches, so it's not for high angle. Backward inclined condylar head. That can be a right. Increase interincisor angle. Increase intermolar angle. Yes, it's handbook. Backward inclined condylar head might be. Yes, they might be. They are looking for option C. You are planning treatment with fixed appliances for a patient who has statutory fallout. What modification to orthodontic is most appropriate for this patient? Is contraindicated? No. Orthodont can be put without any modification. Orthodontic treatment can proceed, but the procedure which may induce a bacteremia should be avoided. Orthodontic treatment can proceed, but antibiotic to any procedure which may induce bacteremia is required. No. Orthodontic can be proceed, but antibiotic to all appointments uh, which may induce bacteremia. Why not C?
These guidelines, and they say you do not need any kind of for all
Antibiotics. You don't need antibiotics, but you have to avoid bacteremia.
Sir,
Like what? Avoid bands, do tubes.
this is what they say, that you don't need any kind of a medication.
Yes,
Even
this is that. This is not about medication. C is about bacteremia. They say that do not do bendings in this patient. Do bondings.
Sir, but they say that the toothbrush and trauma is more towards the bacteria. It can cause a more bacteremia than the bad in the body. So we have decided that we will not do any.
I haven't decided.
We have.
I think it's C. Like what you will avoid any procedure.
Then we have to change all other previous options.
Which one?
We have earlier we decided we will not go for any kind of medication in
Yes.
all circumstances.
Yes. We are not going for. It's not about medication. The C is not about
There
medication.
was one question which we have to, in certain specific treatment, you have to go for the medication, and we decided no, we will not go.
Yes, it's not for medication. It is that you have to avoid any procedure that induces bacteremia. It's not for antibiotics.
For the bacteremia, we have to do the amoxicillin.
We're not going for antibiotics. We have to avoid like what burning versus bonding,
Okay.
right? It's about inducing bacteremia, not about antibiotic prophylaxis. 11 years old female. Sorry, the question. 11 years old patient referred from the GDP complaining from a painful upper first molar, and his GP thinks that you need orthodontic treatment. On examination, the patient has a class 1 incisor relationship with MIH undisturbable first molars. His GDP mentioned that the child refused extraction and John's local anesthesia, so general anesthesia is planned. What is your management for the case? X-ray given. If GA is planned, then go for GA, right? And if they are not reachable, extract the 6s. As a upper first molars and his GP that is may need orthodontic. The patient has a class 1 incisor relationship with MIH undisturbable first molars. So I will go with upper first molar extraction because it's not the ideal age. See, the ideal age is 9. The patient has passed. So I'm going for those teeth which has no hope. Yes. Because it's upper undisturbable 6s. B. Nine years female to your clinic patient with chief complaint of asymptomatic partially erupted 2-6. Like what's the problem here? The second deciduous molar on that side is the second decidual molar on that side. They are talking about the upper one, right? Is still present and slightly mesially tipped. I do not see any problem in the picture. Shows that the distal cusp of the 2-6 erupted and mesial cusp has it's erupted. I explained many such. So yeah. What's in the chat? Picture is upside down. Yes. Okay, picture is upside down. Okay. A patient presented to your clinic with orthodontic breast and she wants to complete her treatment with you. Upon examination, noted poor periodontal condition and the upper act 6 was over erupted. Upon her panoramic with opposing 6 is missing. What is the most appropriate treatment plan? Ideally, the picture should be there, like, but we have to make the plan according to the canine deletions and all those things, the AIDS. The most important precaution with patient with sickle cell anemia during orthodontic treatment is ensure patient take medication before treatment. Extraction is shouldn't be done. Avoid stress during the visit. Avoid any sharp ends of the rough appliances. Extraction is done and no, you do not do extractions. Yes, yes, D. Nine-years with history of epilepsy during his routine examination suddenly fall on the floor and start jerking movements. The seizure continue for 5 minutes. What would we do after calling for ambulance? Early oxygen. If it's more than 5 minutes, then we go for midazolam. B. Patient has impacted canine. He made occlusive radiograph. After 1 year, he made periapical and came to the clinic. To localize the canine, what other X-ray should be taken? For the horizontal parallax, D. 10 years female with class 2 skeletal relationship. Functional appliance was prescribed. The patient doesn't want to have treatment despite her mother insistence. What should you do? Ask them to reach an agreement, right? Explain the potential risk of no treatment for the girl. Ask her to think till a recall next visit. Yes. Ask her recall with 6 months. Discuss the case with the colleague. C is good. Look in the histogram section. The best answer to describe what is happening. Tooth is on my right, and now where is my osteoblast and osteoclast? I do not see a big cell, so I think it is a osteoblast. Osteoblast is on the right, near the tooth. Sorry, the tooth is on the right side. What do you see? Like what? I think they are osteoblast, not osteoclast. On the left side. Yes. Yes. Tooth is moving to the right under tight light force. Yes. These are difficult movements. See. 10 years old female presented with a complaint from malaligned. She has had oral hygiene pattern examination, erythematous spontaneous, asymptomatically and extend from the tip of the tongue. I think it's the same like a geographic tongue. They show her refer to the no, we do not, we just refer. It's not a pathology. It's a, to show you a picture and until something else, you go with this. A coil spring in place between 3 6 for the implant. What is the diameter of the lumen of the coil spring? C. C. A patient presented to the orthodontist. What is the diameter of open coil spring commonly used? 0.010 D. None is a 8 years old boy with a prognatic appearance is accompanied by his parents in his first visit to a general dentist. Done complained of a pain and swelling upright sequence taking his peers that his teeth erupted earlier than his peers. Done pavement incisor erupted at the age of 5. On examination, both done upper 6 were carious. On his 8, the molar relation could be established as they were carious, but deciduous molar relation were in mesoocclusion. All his other teeth were caries free. In addition to extracting the problematic tooth, what else do you recommend? It's versus balancing versus you are extracting, right? So you are not going for temporizing the problematic teeth. They said In addition to extracting the problematic teeth, what else you recommend? So it's a upper right 6. So do not go for the balancing extraction for 6. Extraction recommended no. Balancing and compensating extraction not recommended. A. A fixed appliance therapy has been planned for a 13-year-old boy with a class 2 myopia. The patient is diagnosed case of asthma and is currently on salbutamol. The patient is diagnosed case of asthma currently on salbutamol. During the appliance activation, the patient experienced shortness of breath and start having asthmatic attack. What would be the appropriate line of management for the asthmatic patient? Asthma, administer oxygen therapy with corticosteroid. Non-epinephrine, I think not. So corticosteroid, I did this for steroids. The patient diagnosed case was currently on salbutamol medication. During activation, the appliance experienced shortness of breath and start having an asthmatic attack. We administer oxygen usually with salbutamol, but they have written corticosteroid. The salbutamol is not. Ideally, it should be salbutamol. If salbutamol is not there, what should we do? Adrenaline. Okay. For asthma, they said administer oxygen. Patient on bronchodilator, unavailable. Administer salbutamol in nasal 4 puffs through a large volume spacer. If the patient suffering from the severe episode does not respond to treatment with bronchodilator within 5 minutes, transfer as an emergency. So there's nothing got no right option here. Because usually in the hospital they do administer adrenaline to these patients. So in fact, corticosteroids, decadrons. Yes. A. We go with A then. But this is mostly the hospital emergency treatment. Okay, I think we solved all the questions for today. It's the last question. Attend the assessment. Her mother has been unwilling to bring her. She thinks that her teeth are fine. You feel that she would benefit from orthodontic treatment. It's a 16 years, so she give her consent on her own, right? And it's in the best interest. Arrange to proceed with him because the patient is 16 consent. E.